Hi, from beautiful Vancouver, Canada. Thank you for the opportunity to present at SLS. My name is Abdulaziz AlGhurair. I'm a surgical fellow at the University of British Columbia SLS training program in MIS, General and Colorectal Surgery. I come from Kuwait, where I did my medical training and residency in general surgery. I would like to thank my mentors, Dr. George Melich and Dr. Elena Vikis, for the honor to train under their leadership in their premier surgical training program. We would also like to acknowledge the support of the Royal Columbian Hospital Foundation and their leadership in advancing care in their region. Today, I will talk about one of our recent research projects investigating the correlation between preoperative MRI staging and the pathological stage of TAMIS excised specimen as it pertains to rectal cancer. Biological basis of colon and rectal cancers is similar. However, because of its isolated location in pelvis, rectal cancer staging and treatment approach differs from the approach for colon cancer. Preoperative staging in rectal cancer is essential in determining neoadjuvant surgical and adjuvant treatment approach. Standard approach for such workup includes specimen biopsy and staging of the local disease with pelvic MRI. Standard specimen biopsy with forceps or snare during colonoscopy often result in inconclusive tissue diagnosis and requires repeat endoscopy or treatment based on uncertain pathology. Furthermore, upfront biopsy of such lesion often distorts the site prior to staging with MRI. For smaller lesions that are amenable to this, our practice is therefore to obtain an MRI of the undistorted lesion followed by excisional biopsy with transanal minimal invasive platform or TAMIS for short. Of course, regardless of the fact that our biopsy specimen was obtained via the TAMIS platform, the actual treatment consisted of standardized treatment guided by established NCCN guidelines. TAMIS is a platform capable of providing full thickness excision and defect closure with laparoscopic instruments under insufflation with further video assistance. TAMIS has the potential of obtaining a full thickness resection of small rectal lesions. In analyzing our prospectively maintained database, we noticed a discrepancy between preoperative MRI and the TAMIS pathology result. Surprisingly, we found that the lesions were MRI overstaged in 44% of cases and understaged in 16% of cases. I will discuss our study more systematically since majority of centers rely on preoperative staging by MRI in guiding their treatment of rectal cancer. Our objective with this study was to investigate if the MRI staging correlates with excisional biopsy specimen. In this retrospective review study, we analyzed our prospectively maintained database of 186 consecutive cases, which were subjected to MRI staging followed by TAMIS excisional biopsy. We have included in our study cases that were referred to us with suspected recurrences at previously treated sites. The cases were performed from 2012 to 2019. Again, I would like to emphasize that this served only as diagnostic strategy, and that final treatment was guided by well-established NCCN treatment guideline with the caveat that transanal excisions, including excisions with TAMIS, are acceptable definitive treatment of early rectal lesions staged as T1 with shallow submucosal SM1 invasion or better. Results. Only 39% cases resulted in MRI and pathological correlation. 44% of cases resulted in MRI overstaging, and 16% of cases resulted in MRI understaging, and 1% of cases resulted in alternate non-suspected pathology. This includes prostate cancer and foreign material. Our study involved population with typical demographics. 124 of the final pathology specimen were non-malignant and 62 were malignant. The distribution of 44% of cases overstaged by MRI is outlined in this slide. Based on NCCN treatment guidelines, this would lead to over-treatment in all of these cases. The distribution of the 16% of cases understaged by MRI is outlined in this slide. Based on NCCN treatment guidelines, this would lead to undertreatment in 2 of these cases. These 2 cases shown at the bottom of this slide would be denied neoadjuvant chemoradiation treatment if based on MRI alone. In conclusion, only 39% of cases resulted in perfect correlation. 44% of cases were overstaged by MRI, which could inadvertently result in eventual over-aggressive treatment. Adopting excisional biopsy with TAMIS to staging algorithm could have an impact on the need for radical treatment in rectal cancer. Again, thank you for the opportunity to present and have a good day.